For the rest of this talk, I'm going to go through three kinds of treatments. Now, overall, the best tested and the most effective treatment is something called light therapy. And for that, and because it's the most tested and shown to be the most effective with the least side effects, we'll emphasize that one the most. There are three primary types of light therapy. One is bright white light therapy, one's called blue light therapy, and the third is dawn simulation, and we'll spend some time reviewing each one. A second treatment that has some effect, some evidence for its working is what's called cognitive behavioral therapy. We'll talk about that a little bit. And then the third is antidepressant medication, which does have pretty good evidence for being helpful for seasonal affective disorder, but it has the downside of having fairly significant side effects. And so, therefore, we usually recommend light therapy for most people over antidepressant medication if they're able to implement light therapy. What is light therapy? Well, light therapy involves sitting in front of what's called a broad spectrum white light for a certain amount of time each day. Now, that varies a little bit according to the person, but typically it's about 20 to 90 minutes. And what you do is you figure out how much you need. For most people, 20 to 30 minutes is good, but some people may need up to 90 minutes a day. And for most people, it's something that you do just by sitting in front of this light in the early morning, ideally before dawn. You know, dawn comes kind of late in the winter, and so usually what you want to do is sit in front of this light before dawn. So it depends upon the person, but sometime before 9 a.m. Oftentimes it would be best to be before 8 a.m. You can do it while having your breakfast, while reading the paper. You can be doing lots of different things while you do it. The important thing is that you're sitting in front of it and that you are kind of at the right distance from the light. Now, while you sit in front of this light box, you can do any of your normal morning routine. Just depends upon what that might be for you. You could check your email. You could read. You could put on makeup. You could do your hair. It really doesn't matter. What matters is that you're in front of the light box and that occasionally you might glance at the light box. So it's pretty easy to implement, and for most people, they tend to see effects pretty quickly within a week or two. And if you don't see effects in a week or two, you usually have to change something about what you're doing. But typically, you know pretty quick whether it's going to work. Most people also have very few side effects. Probably the most common side effect is some people get headaches. And if you get headaches, for most people, they go away pretty quick. After they use it for a few days, the headaches will go away. But for some people, they can continue, and then that might be a problem that you need to decide how you want to respond to that, whether to go to a physician to talk about it, whether to switch to a different treatment, or perhaps to discontinue light therapy. Light boxes cost about, it depends upon where you get them, but they typically cost about $200 to maybe $500. And while you don't need a prescription to use a light box, oftentimes it is a good idea to get a checkup at a physician or a psychiatrist or at a psychologist if you feel like you're having significant symptoms, because sometimes the effects can be due to other things than the low light in the winter, and it's important to get those things checked out. But you don't need to have a prescription for a light box. You can buy it over the counter, and it is possible to implement this on your own. Some people find that they need help, and perhaps a support group or a therapist to help them to implement this can be something that can be helpful. The other thing that can happen is some people discover that a single morning session isn't enough. That there's research showing that for maybe two-thirds of people, a single episode of sitting in front of the light box in the morning is enough. But then there's a group of people that could also benefit from sitting in front of the light box sometime in the evening, up to maybe 7 o'clock, maybe between like 4 and 7 o'clock. You don't want to get in front of it too late because, like I said earlier, bright light serves as a signal for your body to wake up. Um, and so if you sit in front of it too late, then it might interfere with your falling asleep. But especially if you're somebody who finds yourself falling asleep early in the evening, that is a good sign that you might want to do a second dose of light therapy in the early evening. Now I'm going to set up a video where I illustrate how to use these various devices, but for today, I just want to give you an example of what it might look like to sit in front of one of these. So here's a couple pictures of devices and what it might look like. You see a person at a computer, a person reading, whatever. The amount that they recommend you sit in front of the device depends upon how close it is to you, because it has to do with how much light of a high intensity hits your eyes. So you also want your eyes open, and you want to be kind of looking somewhat towards the device, but usually you want it a little off to the side, because the point isn't to stare directly into it. That's not really a great idea. But to have it a little bit off the side of where you're looking and to occasionally glance at it. Don't need to make it complicated, but this is helpful. Um, and so just some rough guidelines. Usually what is recommended is if the device is about 13 inches from your eyes, you want to be in front of it for about 15 minutes. If it's about 20 inches, about 30 minutes. If it's about 30 inches, which is about the length of most people's arm, you want to sit in front of it for about 45 minutes. And if it's about 40 inches, you want to sit in front of it for about 60 minutes. Now, some people need a little more, some people less, but those are some rough guidelines. So you can see it pays to keep it a little bit close if you want to have less time that you're going to sit in front of the light box. Now, while it's generally pretty simple to use light therapy, there are a few common mistakes that if you do it, it can interfere with the effectiveness. One of the most common is starting too late in the morning. So like I said before, it's best to start before the sun comes up. Another common mistake is sitting too far away. You want it fairly close, certainly within the length, the distance of your arm, typically closer than that and a little off to the side. Another problem is sometimes people need to sit in front of it for a bit longer. The other thing is you want the light to be hitting your eyes from above. So if you look back at this picture, these people are looking down. So even though the light box might be slightly below their vision, they have it oriented so that at least some of the light comes over the top of their eye. The idea is that it seems like the sensors that receive this kind of light are located on the bottom of our eye, because it looks like we evolved to pick up the light coming from the sky, the bright light of the summer sky, which is always above us. So we want the light to be above our eyes. If you don't want the light on the floor below you, or else it's not going to be hitting the right part of your eye. So at least at eye level, and you can even put it above you if you want. Again, if you find yourself nodding off early in the evening, you might want to add the evening session. For people diagnosed with bipolar disorder, if you're going to try to use light therapy, you want to do it with supervision. There's some suggestion that for people with bipolar disorder, light therapy can sometimes kind of cause a manic episode. And if you're either taking antidepressants Or if you have eye problems, you want to get your vision checked out before you implement eye therapy. There are some kinds of antidepressants that can make your eyes sensitive to light, such that your eyes might be damaged by light therapy. Now, if you don't have eye problems, and by eye problems, I don't mean just wearing corrective lenses, I mean more significant eye problems than that. If you don't have significant eye problems, and if you're not on antidepressants, then or another kind of medication that might affect your eyes, you should be fine with light therapy. They've tested it in tens and hundreds of thousands of people. But in some cases, it can cause problems, and you want to get your eyes checked out before you go on it if you have any concerns. Another alternative light therapy is something called blue light therapy. Some researchers discovered that there's a certain wavelength of light that our eyes seem to be, that this part of our eyes that links to the circadian rhythms in our body, our eyes seem to be sensitive to this particular wavelength of blue light. So they've started to do some research on light boxes that only emit this type of blue light. Now, we don't know yet how effective that is. We don't know if it's as effective yet as light boxes, the white light therapy. So I generally suggest people go for the bright light boxes, the white boxes. But some people find that more difficult or really don't like it. And the blue light therapy then can be an option because it does have some fairly good research evidence. It's just not as established and maybe a little bit more risky. But if it works for you, if you try it and it works for you, then it's great to go with it. One of the benefits of blue light therapy is that the devices are generally cheaper. Now, any of these boxes can be found online at any of a number of different places. One of the best is lighttherapy.com. You can get any of these there. Um, Another treatment that's been used is something called a dawn simulator. And the way this works is you hook it up, it's either a separate device or you hook it up to a bedside lamp. And what it does is it begins to light up slowly in the morning like an alarm clock, but gradually it lights up and it wakes you up as if the sun were rising, like in the summer. And again, if you decide to use this, you want to use it early in the morning before the normal sunrise. And it's important to get an actual dawn simulator because you want the bulb that's going to come on to be quite bright, at least 100 watts. And there's some companies that make these Zen alarm clocks and things that have a light that comes on, but it's not very bright. It needs to be bright in order for it to work. And there is some research showing that the dawn simulators work for a good number of people. It doesn't seem to be as effective as light therapy, but if it works for you, it's almost no work because you just set it to go on at the same time of day every day, and you don't have to do much except get up when it wakes you up. And if it works for you, then it's a great treatment. But unfortunately, it's not as effective for as many people as light therapy. Now, some people will use both because the dawn simulator can just make it easy to wake up in the morning. Some people find it's a more pleasant way to wake up in the winter than to, say, a blaring alarm clock. And it can help just to regulate your sleep and help you to have better quality sleep.